Chapter 5 is a discussion of the integument, which is the skin and all of its appendages, such as hair and nails. And the skin consists of three major regions: the epidermis, which is the most superficial or outer layer, the dermis, which is the middle layer, and then the hypodermis or superficial fascia, which is the deepest region. And we have a subcutaneous layer of fat that's deep to the skin, and it may have more or less adipose tissue depending on the individual. Here's a basic picture of what a layer of skin would look like. This is the epidermis. You see, it's a very small section of the skin. This is the dermis, a much thicker section. It's divided into the thin little papillary layer and the thick reticular layer. And then the hypodermis is under here, and you just see a lot of adipose tissue. Okay, now we'll look at the dermis just a little bit from this picture. As you see, since this is epithelium, the epidermis is, there's no vascularity in here. There are some glands coming and excreting their surface like an eccrine sweat gland here. We have hairs coming through it, and they start here in the dermis, and this is sebaceous oil glands. And here is some nervous structures, pancreas, corpuscles, sensory nerve fibers, hair root plexus, and we'll discuss these as we continue. Okay, the epidermis is keratinized, stratified squamous epithelium. You have stratified squamous epithelium even on mucous membranes, but the difference is that this is keratinized. It's thick enough so that the outer layer has actually died and formed a thick layer of fibrous protein called keratin. It's just basically leftover dead cells. And the original cells are called keratinocytes. Epidermis also contains melanocytes, and they produce the pigment melanin that gives us the color to our skin. Maybe dark, maybe light. We also have dendritic cells or Langerhans cells, which are macrophages and involved with the immune system. And then we also have touch receptors, also called tactile or Merkel cells. Now, the layers of the epidermis, the layer at the very closest to the dermis is the stratum basale. It's also called stratum germinativum. Think of a plant germinating. This is the beginning, the stem cells. They rapidly divide. You always keep a layer of stem cells in this layer. And it takes about 25 to 45 days for it to go from the basal layer up to the top. Next layer is stratum spinosum. It's starting to get some little filaments attached to desmosomes that are pre-keratin filaments. And there's also a lot of melanin in here, as well as dendritic cells. The stratum granulosum is 3 to 5 cells. This is where you're starting to get true flattening of the epidermis. Stratum lucidum is only in thick skin, so there is a difference in thick and thin skin. It's a thin, transparent band, superficial to the stratum granulosum, just a few rows of dead keratinocytes. And then the outer layer is the horny layer or stratum corneum, 20 to 30 rows of dead, flat, keratinized membranous sacs. So when you look at your classmate's face, when you look at my face, what you're seeing are these dead cells. And that's good because it protects us. Protects from abrasion, penetration by splinters and other things, waterproofs, barrier against biological, chemical, and physical assaults. These are the layers. This picture is drawn kind of oddly. The stratum basale, they show a layer across here and then have the dermis. You would have the dermis actually coming up to that stratum basale. So it's just one one row of actively mitotic stem cells. And then as they grow, you divide into two cells, you push one up, one stays back, and then over and over. The next layer north of this is the stratum spinosum. And they're starting to get a little bit of filaments that are pre-keratinous. The stratum granulosum, 3 to 5 layers thick, and your flattened cells, the cells are starting to die, organelles are deteriorating, and in your thick skin, you're going to have a layer of the stratum lucidum, and then the external, as you see, is most of this skin is stratum corneum, 20 to 30 layers of dead cells. Now the dermis, which is underneath the dermis, strong, flexible connective tissue. Leather is made up of the dermis of a cow or whatever the leather was from. It has connective tissue, which has also fibroblasts, macrophages, mast cells, white blood cells, and it has 2 layers, papillary and reticular. And here again, the papillary, here, reticular is most of the skull, most of the layer. Papillary is, it does have collagen, connective tissue, elastic fibers, blood vessels, and has dermal papillae, thus the name papillary layer. And this has free nerve endings, Meissner's corpuscles, and capillary loops. The reticular layer, 80% of the thickness, collagen fibers are there for strength and resiliency, elastic fiber to give it its stretchability. Now, skin markings are friction ridges, and they're epidermal ridges lying atop the dermal papillae to form fingerprints. And as you all know, your fingerprints are unique. Now, the skin also has collagen fibers arranged in bundles of strength, which are called cleavage lines. Not the same kind of cleavage lines that you may have known about in the past. And this is something to study surgeons, because if you make these parallel to these lines, and here's a picture, here you have cleavage lines like along here, along this circle, here on the leg, here. If you make an incision this way, you're not hiding. So like if you have a cleavage line here, and you cut here, this is going to be pulling, and it could pull your incision apart. So surgeons are going to have to study of these. So if you cut this leg like this, it would not heal as well as if you cut this leg like this to remove, say, a mass or something. Okay, so the pigments. 3 pigments are involved in giving the skin its color. Melanin first. And everyone, unless they're albino, has melanin. Some have more than others, but the biggest difference is you have different colors of melanin. It can be yellowish, reddish brown, black, very, very, very pale, peachy colored, like in really extremely pale Caucasians. But they are produced, it is produced in the melanocytes, and then it migrates up above the keratinocytes, and it forms a shield for the nuclei of the keratinocytes. So the melanin protects the skin from skin cancer. Now, freckles and pigmented moles are simply accumulation of melanin. Now, the purpose of the melanin is to protect the nuclei of the keratinocytes, therefore greatly decreasing the chance of skin cancer. And when you think for a minute, who is more prone to skin cancer? It's pale-skinned people, because they don't have that dark melanin that protects those keratinocytes. And where do their ancestors come from? Either Africa or perhaps other equatorial areas. And there's a lot of sun there, and it hits really hard. Now, then as man migrated, and they migrated into Northern Europe, mutations allow there to be a decrease of melanin in the skin. That was an advantage because, one, there's no sun to burn you and give you skin cancer anyway. And the other reason is that you can get the vitamin D because the melanin will prevent some vitamin D resorption. So if you're darker skin, you may have it's easier to get a vitamin D deficiency. However, you're more resistant to skin cancer. Carotene, yellowish to orangish, mostly on the palms and soles. Excess carotene in the diet can cause little children to become orange, especially little light-skinned kids. Their parents will come in thinking they're dying, and they just ate too much baby food. Hemoglobin is responsible for the pinkish hue in the skin. Now, in light-skinned people, you can easily see if they get hot, they turn red. The exact same phenomenon happens in very dark-skinned people. It's just covered up by the melanin. They also, if the person does not have enough oxygen, in a light-skinned person, this hemoglobin will be bluish, so they'll turn bluish, whereas in a dark-skinned person, they may actually look sort of grayish. Now, derivatives of the epidermis, appendage of the skin, we'll talk about sweat glands, oil glands, hair and hair follicles, as well as nails. Sweat glands, we have two main types. Sweat glands are also called sudoriferous glands. Eccrine sweat glands are just your regular old sweat glands that help cool you off, thermoregulation. They are connected to the skin through pores, and you do have them on the palms, soles, forehead, as well as on your back, and pretty much anything that gets wet when you're hot. 99% water, a little sodium chloride salt, little vitamin C, antibodies, dermacidin, some metabolic waste, not enough metabolic waste to do you any good as far as cleaning out your bloodstream. Apical sweat glands, on the other hand, are confined to the axillary or underarm areas and anogenital areas. These are your pubic hairs and hairs in the genital region down there. And they produce not regular sweat, but sebum, which is a combination of sweat plus fatty substances and proteins, and they connect from ducts to hair follicles. They don't function until puberty, which makes some people think they may actually be some sort of pheromone. Now, this is in a clean person. Now, when you start to get the stink, funk, horrible deodorant failure that we've all had at some point in our life, that odor is coming from bacteria that has started to break down the sweat. Okay, this is a goat, Bobby, and you can see his beard here, and it is yellow. It is yellow because he urinates on it. He urinates on it because his urine has pheromones that attract girl goats. So all the goats will come running. Humans, not so much so. We don't particularly tend to like that odor. Other type of apical glands, ceruminous glands. This is earwax. They make earwax. And then mammary glands make milk. It is not a sweat. It may be built like a sweat gland, but mammary glands actually extract proteins, calcium, phosphorus, vitamins, everything a baby needs to exist is extracted from the mother's bloodstream by the mammary glands. Okay, and this is just showing a sebaceous gland letting go into the hair follicle, which is an oil gland, sebaceous glands. Always with hair follicles, again, these develop at puberty, and these are actually it's a sebum, but it's oily Holocron secretion. And the point of having it is bactericidal and then soften hair and skin. Now, if you recall, a Holocron secretion means that the gland that produced that oil ruptures. I reminded you in an earlier chapter, American glands excrete their stuff into ducts, but Holocron glands, the individual gland cell, gives its whole life, it ruptures. And here you have the sebaceous glands there. Now there's many, many cells, but the individual cells rupture and secrete the oil. Acne comes from excessive hormone production, excessive sebaceous gland, oil gland secretion, and these glands tend to get stuffed up. Okay, hair has many functions. Now, in animals, they have hair to keep them warm and to protect them from the sun. Now, the hair we have, except on the top of our head, is not going to keep us warm or protect us from the sun. But it does alert us to the presence of insects, and this is very important because malaria, which is spread by mosquitoes, kills more people than almost anything. It's just a horrendous number of people die of malaria every year. Not so much in Georgia, but in the world. Also, guards the scalp against trauma, heat loss, and sunlight. Keeps you from getting sunburned. If you have no hair on your head, you might need a hat. Distribution of hair on the entire surface of the body except palms, soles, lips, nipples, and portions of external genitalia. And I will let you check into which portions on your own time. Okay, hair is made of dead, keratinized cells, and it's hard keratin. It's a lot more durable than soft keratin. Pigments in it are melanins, yellow, rust brown, pure black, or every shade in between. Some people have very, very red hair. Gray or white hair is because as one has developed along in age, and I will say some people have white hair at 17, 16, but they decrease melanin production and air bubbles get in the shaft of the hair. Now, here is a diagram cut across right here, and you can see the hair bulb, the hair root, hair shaft. This is a muscle called the erector pili that allows the hair to stand up when you're either cold or when you have sympathetic stimulation as you're frightened or excited. Here's the medulla, the cortex, the cuticle. This area here is the external epithelial sheath, and we have a connective tissue sheath. This is all follicle wall here. And the hair follicle, and this is kind of thought of backwards. It says it extends from the epidermis into the dermis, but it actually starts in the dermis and comes out through the epithelium. And we already discussed the parts: the hair bulb, outer wall, connective tissue root sheath, inner epithelial root sheath. And it also has a hair follicle receptor or root hair plexus, where we have sensory nerve endings around each hair bulb. They're stimulated by as little as bending of a hair, and that allows you to feel when you have bugs on you. Also, if someone pulls your hair hard, you can definitely feel that. The erector pili muscle is a smooth muscle attached to each hair follicle, and if you're cold, you get goosebumps because that hair pulls up and makes a little bump in the skin as it pulls up. And also if you're nervous or excited. Now, we're going to look at reasons why humans would get it after we're looking at animal. Okay, this cat is very frightened, and he's sticking his hair up. His erector pili muscles are in full sympathetic nervous system mode. If you look closely, his eyes are dilated. His back is arched, which makes him look large. And if you have any sense at all, you're not going to lay your bare hand on that cat. He's going to kill you. He's going to make you think you're dead. You can get great injury from just a 6-pound cat. So animals learn and become frightened of these cats and leave them alone. Now, the bird is not a mammal, but they have a similar setup with their feathers, an erector pili muscle that causes them to fluff out when they're cold. They also do it when they're sick, when they're stressed. But when they're cold, it fluffs out and allows air pockets to get in under these feathers and keeps them warm. Now, when you look at this person here, he's playing cards. He's wearing long sleeves and he's got on sunglasses. Okay, the sunglasses keep you from telling whether his eyes dilate. The sleeves are keeping you from seeing if he has goosebumps. And what he's thinking is if he has a winning hand, he doesn't want you to know it. He wants you to gamble against your winning hand. And by wearing these long sleeves, you won't see the goosebumps. So if you learn to read people, if their eyes are dilated and they have goosebumps, they're very excited about something. Whether they're angry, upset, frightened, or whatever, they are in sympathetic nervous system mode, which means you need to watch out. They're up to something. Okay, and this is just showing you where in this same hair follicle we looked at earlier, where some of the different parts are. We have the melanocytes, is what I was looking for. So right here, melanocytes, they're right in this area. And they release their melanin pigment up in here into the medulla area, at the very center of it, the cortex area, I'm sorry. This is your medulla. Into the very center of it is where you're going to get your melanin. And we looked at hair and you could see the different shades and pigments of hair in a very easy to see cortex and medulla. Okay, vellus hair. Hair, eyebrows, scalp, axillary and pubic hairs, and then the face and neck of males. And they're different, definitely different in textures. Now, hair growth has a growth phase, which may be weeks to years, and then a resting stage, or where it stops growing. The growth phase varies on the scalp hair, 6 to 10 years, then it stops. 3 to 4 months in eyebrows. So when your eyebrows have done all the growing they're going to do, they stop growing, another one, they shed out, another one takes its place. Otherwise, your eyebrows, let's just draw some eyebrows. This would be normal eyebrows. If you didn't stop growing, they would hang down like hair, and that would look very dumb. That's eyes, eyelashes. I was going to teach art, but no one really wanted me to, so we'll just stick with this. But the scalp hair, it's okay that it grows long. Some people can grow very long scalp hair, other people less long. And the reason being is just strictly genetics. If you can grow very long hair, that's great. If you can't, that's your genetics, and that's great too. Alopecia is hair loss. Now, the book talks about it. They seem to only be talking about frank baldness, and then they consider that male pattern baldness. But alopecia just means hair loss. It could be caused by hormonal imbalance. It could be caused by thyroid issues. It could be caused by an infectious disease. Perhaps you caught mange. Perhaps you have, fleas. I don't know what you got growing on your head. I hope you have none. But alopecia is from whatever. Maybe you're nervous from taking anatomy and you pull it out. But male pattern baldness is a specific process. It's caused by the genetics. It's only on the X chromosome. So females are XX, whereas males are XY. XY. It's only carried on this day. It would be a recessive gene, but in the male, they have only one X. So if a male has this gene, which he got from his mother, he will have male pattern baldness once he has enough testosterone to do so. For a female here to get the male pattern baldness, they would have to have 2 copies of the gene, so get it from their mother and their dad. Some females do have male pattern baldness, but it tends to only be expressed when their estrogen levels drop, such as around menopause. The reason is because estrogen inhibits the dihydrotestosterone, whereas males have no inhibition of dihydrotestosterone. Okay, fingernails. These are modifications of the epidermis on the fingers and toes, dorsal surface. These are analogous to hooves and claws in animals. Here are parts. This is the hyponychium under here. Free nail edge. Just get my pointer here. The free nail edge here. The body of the nail. Eponychium is your cuticle right here. Proximal nail fold. The root of the nail here. And this is the body of the nail. Lanula here. Underneath this is your nail bed. Now, and underneath this is the third phalanx of the fingertip. Little fat, a lot of vascularity in between. Now, if you injure this nail and hit it really hard, there's nowhere for the bleeding to go. And so it will fill the area underneath with blood and cause a big bruised black spot and a lot of pain. Now, I'm told that you can take that and get someone to drill it and it'll let the blood out and you won't lose the nail and it will feel much better. I've had that happen. Never been quite willing to let anybody touch it. It hurts so bad. As long as the only thing that happens is this part of the nail is damaged, eventually the nail will fall off and it will grow back. If you have an injury such as a burn or any kind of injury to the whole end that's crushing to the point that it destroys the nail matrix in the bed of the nail, then the nail won't grow back. But an injury, just a blunt trauma here. I tend to get them from horse teeth and things in the barn. Other people trying to hammer nails. Then they will grow back. Okay, functions of the integument. Protection of the things under the integument. First, we have a chemical thing, low pH. Now, a mantle is a cape worn in the 17th century. You wrap it around you to keep you protected. So they're thinking of the skin as a protective mantle or cape. And it has acidity that retards bacterial activity, also defenses. So low pH. And why good quality or even mediocre quality shampoos are going to be low pH, because if you use an alkaline pH on your skin, it's going to irritate and damage it. Okay, physical and mechanical barriers. The keratin and glycolipids are your waterproofing. So water, they block out water-soluble substances. Some penetration does take place by lipid-soluble substances that go right through that keratin. One example here, poison ivy. It goes through the skin, then it combines with proteins in your skin, and then you have a reaction. So it takes 12 to 24 hours. If your kid gets in poison ivy, or if you do, a good washcloth and a lot of soap, strong soap, would be good to scrub them down, rinse them off. Don't put them in the tub, put them in the shower, even if they're standing or sitting, and rinse all that stuff off, and then it won't spread and you won't have as bad a reaction. Some drugs are delivered through the skin. This is the Finnegan patches are the big talk now. because people will put one on and it works. Then they put another and another and another, and then they develop a toxicity. Also, organic solvents can go through and take heavy metals with them, such as lead. We'll talk about lead poisoning in a minute. Okay, biological barriers, you have immune system cells, dendritic cells, macrophages, and then also the DNA of the cells in the upper layer will actually protect the lower layer from skin cancer, from the sun, and therefore from skin cancer. The market is because the people who pump the gas tend to get a little on their skin, it absorbed through, and they started having mental issues, blindness. Acute lead poisoning causes blindness, death, and neurological conditions. Lower level of lead poisoning can cause mental developmental problems. And this was the issue I discussed in class about in small town, where some of the children that lived in the projects they were slow in school. They were developmentally behind. And the state sent in a group of people to test their blood, these children's blood, for lead. And they had lead poisoning because the projects were substandard. They had peeling lead-based paint. And once this problem was solved, they relocated the kids until they could get the lead out of the houses, repaint them, and then treated the kids medically to help with chelation therapy to pull the lead out of the bloodstream. And then their minds got sharper and they started being able to learn. You also need to be really careful not to use lead-based cups, paint. From some countries could have lead-based paint. Your ceramics, or especially homemade things, or antiques. Okay, functions of the integument: body temperature regulation, sweating, and you're going to lose about 500 mLs a day just perspiring, even at normal body temperature. When it's hot, you're going to get even more sweating. You're also going to get the vessels in the skin are going to dilate, and the perspiration, the evaporation of that perspiration is going to cool you off. The dilation of the blood vessels is going to bring that core body blood close to the surface and allow you to cool. Cutaneous sensation is extremely important. You can tell whether something's too hot, touch pain, and what happens with diabetic people whose toes fall off is because they didn't know their toe was hurt until it's already destroyed, because they lose cutaneous sensation because diabetes causes neuropathy that decreases their sensation or completely takes it away. Metabolic functions, forming D3, turning D3 into a usable form, which has got to be usable. D, if you're going to take it as a supplement, has got to be D3. Nothing else works. If it doesn't say D3, you're wasting your time. Also, conversion of some carcinogens and hormones takes place in the skin. Blood volume reservoir. 5% of the body's blood volume is in the skin. So when a person is in shock, they will divert that blood away from the skin, and they'll have a little extra for things we care about now, like brains and hearts, things we really have to have going. The skin can survive a little longer without the full load of blood. Okay, some nitrogenous wastes and salt are excreted in the bloodstream. Now, this is showing one of these little pads. You put it on your foot, and I have a link in your original PowerPoints, but the link won't work here, showing where the Mayo Clinic did a study, and they actually tried to figure out what this black stuff that comes off on these little pads is. And they have a color sensor that responds to moist heat. So it's just that your foot is hot and sweaty. They're not cleansing your blood. It's a scam. Okay, skin cancer is another thing. And most skin tumors are benign, which means they do not metastasize and they don't kill you. But we do have three particular malignant cancers we'll talk about. Risk factors for skin cancer is overexposure to UV radiation and also irritation to the skin. Now, some lotions have enzymes that can fix damaged DNA. Now, that I don't know too much about. I hope I said most skin tumors are benign. Cancer is not benign, it's malignant. Three major types of cancers. Basal cell carcinoma, it's the least malignant and most common. Squamous cell carcinoma, second most common, and then malignant melanoma. This one makes you very dead. It kills you soon. Okay, basal cell carcinoma comes from the stratum basale cells. They proliferate in the dermis and hypodermis. 99% of the cases can be totally cured by excision, but they are destructive and they can damage this nose here and any facial things. And these are going to be from constant exposure to the sun. Squamous cell carcinoma, again, keratinocytes of the stratum spinosum. Scalp, ears, lower lip, hands. Prognosis is very good if you remove them surgically quickly. You may also have to use radiation or chemo, and you can actually treat them before they become cancerous. They have precancerous cells, which are very obvious, or early cancer cells, which can be just treated with a topical chemotherapy. This one's going to have to be cut out. It's pretty far along. And I put this cat here under an umbrella. This is a white cat, and this is this cancer in his ears, squamous cell carcinoma. And I put that there for a reason, because continuous exposure to the sun is what tends to cause the squamous cell carcinoma. This cat has no pigment, and this is, you see it. In my profession, I see it on white cats, white dogs' ears, cattle with white around their eyes. Very common. So guess what people tend to get it? Lighter skinned people. Now, don't that if you have dark skin, you can't get skin cancer, because you can. You still need to put sunscreen on your kids if you take a beach vacation, but the risk is not as severe. Malignant melanoma involves melanocytes, and these, I believe, come from exposure to the sun at an early age, and these are highly metastatic, resistant to chemotherapy, have to be used wide surgical excisions. Some immunotherapies are out. When I mean wide, I had a student that showed us where they took malignant melanoma off her back, and fortunately she was a heavy woman. They had removed skin, fat. The tumor was 6 centimeters. Less than 6 centimeters, 6 millimeters across. Very, very small, about like that. He had removed a 6 by 6 inch section of skin deep through the fat and some of the muscle to save her life. And that was really a traumatic thing. So now here we have the characteristics, and it's really ABCDE rule. Asymmetry. That's the two sides don't match. Border irregularity. Color, it may be black, but it could be brown, tan, red, or even blue, or have multiple colors in it. Once they get past 6 millimeter size, that's a pencil eraser, you're getting into serious trouble. And elevated increases the chance of that being serious. And this is melanoma here. Okay, the next subject is burns. They may be from heat, electricity, radiation, chemicals, but what happens, they're all the same in what they do. Tissue damage, denatured protein, cell death. Now, the immediate cause of death, the immediate threat, dehydration, electrolyte imbalance, and you can get renal shutdown, circulatory shock, and death. This is the rule of nines to help estimate just how much fluid loss there is going to be. For instance, the trunk, the front counts as 18%, the back counts as 18%, and so on. Now, partial thickness burns, first-degree burn, epidermis only, localized redness, swelling, and pain. Second-degree burns, you have epidermis, epidermis and upper epidermal damage, and you get blisters. Now, the reason you get blisters is because you actually have separation of the dermis and epidermis, and fluid forms between those. And that blister protects that skin from infection, so they don't need to be popped. This is a little hand here. First degree burn here, second degree burns here. Third degree burns are full thickness burns. Initially, they're not painful, and there's no edema because the nerve endings are cooked and there's nothing to swell with. It's gone all the way through the skin, and you're going to have to do skin grafting unless it's a very small burn. And this is a picture of a full thickness burn. All the skin's gone. This is going to take tremendous amount of treatment and skin grafts. Severity of burns is critical if 25% of the body has second degree burns. That can be sunburn. I've had that and didn't really think anything about it, except that I really wish I hadn't have done it. If 10% of the body has third degree burns, you can lose enough fluids, protein to die. Face, hands, feet, bear third degree burns. Those can be very serious because face, you can lose your airway. Hands and feet, you can lose the functionality of those. Okay, the last little bit in the, actually it says fetus. This is actually at the embryonic stage. Ectoderm layer becomes epidermis. Mesodermal layer becomes dermis and hypodermis. The lanugo coat is a little coating of hair in the 5th and 6th month of gestation. So a baby born prematurely might be a little fuzzy. He'll get over it. The vernix caseosa is actually a sebaceous gland secretion. Protects the skin of the fetus because this baby's sitting in amniotic fluid for months and months and months. If you sit in the bathtub for an hour, your skin gets wrinkled and the moisture's gone out of it and it's a mess. Well, imagine what the baby's doing. And it's kind of greasy and slimy, and anyway. Okay, developmental aspects. As one in adolescence, they actually get sebaceous activity increasing, so therefore they're more apt to have acne. Then cumulative environmental assaults, such as the two factors that come to mind: excess sun and cigarette smoke, start to show after age 30. Scaling and dermatitis can become more common in your seniors, very old. Epidermal replacement slows, skin becomes thick, dry, itchy, less elasticity. They have cold intolerance, and I think you all know, the room's 95 and grandma wants it turned up. They also are at increased risk for skin cancer because they don't have as many melanocytes and dendritic cells. Got to be really careful about this thin skin for two reasons. One is in your bedridden patients, it's almost impossible to keep them from getting bed sores, which can ultimately lead to their death through infection and that type of thing. But also, their skin will tear. If they fall and you catch them, you can literally tear their skin. Okay, that's all for this chapter, and then we'll be putting up a review. Good day.